Right. Good afternoon or good morning, depending on where you're joining us from. My name is David Davis, and I serve as the project director of the National Center of Excellence for Tobacco-Free Recovery. Thank you so much for being with us for today's webinar, Supporting Your Loved Ones with Mental Illness or Substance Use Disorders and Addressing Tobacco Use, the Role of Families and Family Peers. This session was developed in collaboration with our incredible partners at the National Family Support Technical Assistance Center, and we're thrilled to come together to explore the vital role that families and family peer supporters can play in helping loved ones address tobacco use as part of their recovery journey. All right, just to note that this opportunity is made possible by the Substance Abuse and Mental Health Service Administration, SAMHSA, which has awarded CIA funding to administer the National Center of Excellence for Tobacco-Free Recovery and the National Federation of Families to administer the National Family Support Medical Center. Before we proceed, let's review a few webinar logistics. You can find the audio settings on the left side of your dashboard. All participant phone lines are muted. If you're experiencing any technical issues, please click the chat function, then type your note into the chat box and someone on the CAI team will reach out to help. If you have any questions for the panelists throughout the webinar, please click on the Q&A and type and submit your questions. We'll have dedicated time for Q&A toward the end of the webinar, and we'll do our best to answer any questions submitted during the Q&A. And please note that this webinar is being recorded and the recording will be made available within 1 to 2 weeks after the webinar. And just to note, certificates of attendance are available for participants who attend at least 60 minutes of today's webinar. To request a certificate, please contact Marissa Altamira at the email address listed here. The certificate provides formal acknowledgement of your participation and may be submitted to accrediting or licensing bodies for potential professional credits or training hours, depending on the specific requirements of your organization. And we like to note that all references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine products, and not the tobacco and or other plant mixtures grown or harvested and used by indigenous people for sacred purposes. All right, and we just want to take a moment to tell you a little bit about who we are here at CAI. CAI is a diverse, mission-driven nonprofit organization incorporated in 1979. We work nationally and internationally. Our mission is to use the transformative power of education and research to foster a more aware, healthy, compassionate, equitable world. We do this by providing innovative and high quality training, medical assistance, curriculum development, research, and other capacity building support to make policy, systems, and people change to address enduring disparities in health and life outcomes, particularly for communities that have been marginalized. This includes over 3 decades of experience addressing tobacco control policy systems and social norms change. Now I'll turn the floor over to Gail to discuss the National Federation of Families.
Well, thank you, David. And I see so many familiar faces out there. So there are a lot of people here that know about the National Federation of Families and about NASTAC, the National Family Support Technical Assistance Center. We're a national family-run organization that serves as the national voice for families of loved ones who's experienced mental health or substance use diagnosis across the lifespan. And we, as an organization and as a board, are family run. We have lived experience, meaning that we're family members. We promote family peer support, and I think everybody knows about our great family conferences in the month of November. We're going to be in Chicago this year. And of course, our family peer support trainings and certification programs. And we believe families are experts. Next page. And here's a map. If you go on the National Federation of Families website, nff.org, You can see where one of our local affiliates is. We have many state and local affiliates across the country. I believe we have about 149 now. I know this says 115, but we're growing all the time. So if you ever have a question about family sport or family engagement or anything family focused and family driven, visit our website and look at the map and find a place close to you. Thank you.
Thank you so much, Gail, for providing us with that information. And so, as we proceed today in terms of the webinar, we want to just set the stage for our discussion. So, let's walk through the key objectives we'll be covering during this webinar. Together, we will dispel common myths related to addressing tobacco use for people with mental illness and substance use disorders, describe the barriers, challenges, and opportunities families and family peer support workers experience for supporting loved ones during their tobacco use quit journey, and identify resources for families to use to support their loved ones in addressing commercial tobacco use. And to help us meet today's objective, we've organized a structured agenda to guide our discussion. We'll start with how did we get here, which is a brief overview of how the tobacco industry has historically targeted people with behavioral health conditions. Next, we'll explore the critical role that families and family peers play in supporting loved ones with mental health or substance use challenges in addressing tobacco use. From there, we're honored to hear directly from family peer support leaders, Lachelle Wade Freeman, Melody Smith, and Lucy Absi Lopez, who will share their lived experiences and insights. We'll then reflect on how we can reimagine the way forward and identify key knowledge and strategies to strengthen this work. After that, we'll open the floor for Q&A session, followed by a closing segment where we'll share how the National Center of Excellence for Tobacco-Free Recovery and the National Family Support Technical Assistance Center can continue to support your efforts. All right, before we dive in, I'd like to take the time to introduce today's presenters. Today's presenters will include myself, David Davis. We have Gail Cormier, and I'm so sorry, Gail. Please correct me if I mispronounced your
It's
last name.
it's Cormier. You're perfect.
Thank you so much. Was a project director of the National Family Support Technical Assistance Center. We also have Lachelle Wade Freeman, who's a project manager at the National Federation of Families. Melody Smith, who's a family support partner from the Montgomery County Federation of Families for Children's Mental Health. And Lucy Absi Lopez. And Lucy, my apologies if I mispronounced your name. Did I get that correct?
It is correct.
Thank you so much, Lucy, who is also a family support partner at the Montgomery County Federation of Families for Children's Mental Health. Great. And so, as we anticipate to dive into today's discussion, let's take a moment to get to know who's in the virtual room. We saw a lot of comments and people saying hello to each other in the chat, but we'll start with a quick poll to see who has joined the webinar today. All right, things are coming in. Wonderful. All right, just a few more votes we're going to be tallying. Great. All right, Marissa, I think we can share those results. Great. So as you can see here, we have a large amount of mental health substance use providers, good amount of family peer support specialists here, great number of family member of someone with a mental health substance use disorder. Welcome here to this webinar, and some folks from state and local government. Thank you all just for sharing and for letting us know who's in the room. Great. And we're going to do another back-to-back poll, right? We're just polling, going crazy with the polling today. But we really want to take an opportunity to ask everyone here who's in the room, how has tobacco use impacted your life? We're going to launch that poll. Grateful if you can share how has tobacco use impacted your life. Um, Melissa, whenever you're ready, you can share those results. Great. So I see here, the majority of folks are saying, I have a family member or a friend who has health negatively been impacted by the use of tobacco products, right? Great amount of people say, families that I work with use tobacco products, or I have lost a loved one due to tobacco related illness, and folks are sharing there. So thank you all for noting that and for sharing. And as you can see from the poll results, tobacco use has touched many of our lives in personal and powerful ways. But how did we get here? How did tobacco become so deeply woven into our communities, especially within mental health and recovery spaces, despite everything we know about its harms? So, to answer this question, let's take a look back at the historical forces that have shaped this landscape. All right. The history of big tobacco's advertising and promotion of cigarettes to people with mental health and substance use conditions reveals a troubling pattern of targeting vulnerable populations. In the mid 20th century, tobacco companies began to recognize the potential market among individuals with mental health and substance use issues. Advertisements often portrayed smoking as a means of relaxation and stress relief, appealing to those facing psychological distress. Many campaigns feature celebrities and doctors endorsing. And in the 70s, the 80s, tobacco companies ramped up their efforts to market cigarettes in settings where individuals with mental health challenges congregated, including hospitals and treatment centers. Promotions often included discounted cigarettes and sponsorships of events. Inpatient behavioral health facilities gained a reputation through the 1900s to the present time of utilizing cigarettes and smoke breaks as a reward system for progress. Smoking with clients has previously been a way for behavioral health workers to build rapport. A lot of us, me as a social worker back in the day, that's really was something that was just a norm. We went outside and we had conversations and spoke with people and talked about their goals and things that they wanted to address. And smoking was sometimes part of that conversation. And today, in many behavioral health settings, smoking has become a ritualized activity, often used not only as a coping mechanism for stress and anxiety, but for socialization. So, big tobacco's predatory marketing practices have left a lasting legacy that continues to affect individuals facing mental health and substance use challenges today. Smoking has, in many contexts, become normalized as a coping mechanism or even as a part of the recovery process, really perpetuating a cycle that makes it difficult for those in need to break free from the addiction. And so, despite the overall decline in national smoking rates among adults, we're still seeing big tobacco's impact in our lives as smoking rates are significantly higher for those of us with serious mental illness and substance use disorder. The smoking rates for people with schizophrenia is 85%. It is 70% for people with bipolar disorder, 24% for people with major depressive disorder, and between 65 to 85% among people in treatment for substance use disorders. So these numbers tell a very powerful story, one of disproportionate harm, systemic neglect, and communities that have been left behind. But the impact of tobacco just doesn't stop at diagnosis. It extends across the lifespan, affecting physical health, emotional well-being, and family systems. Let's take a look at how it does that. So the impact can begin even before birth. When someone smokes during pregnancy, it can harm the developing baby, leading to low birth weight, damage to blood vessels, and poor lung growth. All of these increase the child's risk for heart and lung problems later in life. The risk continues through childhood. Children exposed to secondhand smoke are more likely to develop asthma, ear infections, bronchitis, and pneumonia. They also face a higher risk of sudden death, infant death syndrome, behavioral health issues, and even delayed cognitive development. And as children grow, the impact of tobacco can continue in new ways. Adolescence is a particularly critical time. Many people who smoke start during their teen years, often influenced by peers, family members, or targeted marketing. Nicotine is extremely addictive, and starting young can set the stage for a lifelong struggle with dependence. Beyond addiction, tobacco use during adolescent stage disrupts brain development, especially in areas tied to attention, learning, and memory. It has also been linked to increased anxiety, depression, and other mental health challenges, creating compounding barriers to well-being. And in young adulthood, by this point, the health damage accelerates. Smoking increases the buildup of plaque in the arteries and it slows lung development. And at the same time, it continues to worsen mental health, adding stress to already challenging life transitions. So all of this leads to a much higher risk of dying early, whether from heart disease, stroke, lung disease, or long-term mental health issues that began years earlier. So the earlier someone starts smoking, the deeper and more lasting the damage can be. But that also means early support and intervention can make a powerful difference. This is where families and family support partners play a crucial role. And so I'm going to turn the floor over to Gail to really discuss the role of families and family peers.
Well, next page, please. So, a family peer specialist, as some of you may know, according to the poll, a family peer specialist is someone who has lived experience, who is a parent or a family member or primary caregiver supporting a child of any age and helping them navigate the systems of their own family. And now the family peer specialist is helping other like family members. Um, what we really look at is primarily mental health and substance use disorder, and we consider tobacco part of the substance use disorder. And again, like David said, um, our family members oftentimes use tobacco as a way to relax and to self-medicate. And of course, a family peer specialist can speak about their own lived experience to support other families, to be a champion for the child's or family members' well-being, supporting them in navigating systems, and providing other necessary resources. Next page. And of course, why do we focus on the lifespan? Well, it's easy. I have three children, all who have mental health or behavioral health diagnosis. And currently, they're all over the age of 18. I have from 27-year-old to a 40-year-old. And when that phone rings, my heart still beats and skips a beat because you never know. A child is your child for their entire life. And a mental health crisis is a mental health crisis, whether they're 16 or 36. Next slide. Michelle?
Good afternoon, everyone. I'm Lachelle Freeman, and as stated, I work for the National Federations of Families as a project manager. And I have, I'll say my child, which is 24 years old. So that lifespan is very relevant because he's always going to be my child. But around COVID, I started kind of smelling different odors in the home, like fruity smells and stuff like that, to find out that he was vaping. And then he that led to him smoking marijuana. And I do have a strong history of mental health in my family. And so we don't really know what the onset was, but the onset of his severe symptoms was from smoking marijuana. From then, he went through getting mental health treatment, and just as a mom or a caregiver, I'm constantly the one who is saying, hey, check this. Did you schedule your appointments? Did you take your medication? So I'm constantly like on him with that. And then when he came home for one of his hospital stays, he was smoking cigarettes, which was very new. So I was alarmed because, of course, just the whole impact on your health, smoking cigarettes. But as a mom and being, working in this field, I still did not address it with him for whatever reason, because he looked stable, right? And there was just such conflict in my mind because I know that his health is being impacted by the smoking of cigarettes. But in my mind, I rationalized and basically said that, you know what, he's stable, he's working, he's doing fine. So I'm not going to say anything about the cigarettes. But when he does come to my home and I hear him coughing or first thing in the morning going outside to, smoke a cigarette, it really it really impacts me. So the thing is, I had not thought of ways until I was introduced to this group, which I'm very grateful for, in terms of tobacco-free recovery. And I have the idea for, as the Easter is coming up, every so often I give my 21-year-old and my 24-year-old Easter baskets. So he will have some patches and some lozenges and some other things in his basket with Easter candy. And I don't know if I'm doing eggs, but we'll see. We'll see what we do with that. So I would like to turn it over to Lucy and Melody to talk about how they work with families around family peer support around smoking. And the last thing that I will say is, again, it is such a distress for the caregiver who's constantly reminding a child or a young adult to take their medications or be on top of their mental health. I have switched a lot of that over to his responsibility, so I'm not checking as much. So this may probably just be a great safe time for me to start checking in with him around tobacco. Melanie, Lucy?
Hello, my name is Melody Smith, and I am a family support partner. Having raised 3 children with all with mental health challenges and medical issues as well, and I'm currently raising my 2 grandchildren. Of my 2 children, 2 of them, my 2 sons they started very early experimenting, I'm going to say in their teens, experimenting with cigarettes. And I thought that we had gotten a handle on that. And as they went into adulthood, they began using marijuana. Currently, those 2 sons that I speak of are deceased as a result of a drug overdose that I feel like started with the use of tobacco. I now have, as I said, I'm raising my 2 grandchildren, 13 and 14. And just recently, as much as I've talked and educated and have had this experience of them losing their uncles, I'd never imagined that recently, he was 12 at the time, he just turned 13 on Monday, would, while looking in his backpack, discovered that he had a vape, a nicotine vape. And that scares me because I am afraid of where it could lead to. His mother checked his phone and found out that he had vaped in the past. She recently checked his phone, looked in and found out that he had vaped with friends in the past. When we discussed this with him, it was mainly peer pressure. His friends were doing it. He expressed that nicotine wasn't a drug. So we had to have a real conversation about that. It is a drug, So I think that our youth are that young, are kind of ignorant to the fact that it is a drug and it is addictive. They think it's just being cool. We talked to his therapist. So his therapist now, he has mental health challenges as well. And his therapist is working closely with me. And I discussed the situation with the school. So we're also working with that path as well to educate him. And every opportunity I get, I try to talk to his friends and his peers concerning the use of vaping, tobacco, nicotine, smoking, and where it could lead and how it affects your health. How it affects your mental health. Um, he also has asthma. And so maybe it was there before and I didn't see it because his asthma had been in control. Well, it was there before and I didn't see it. But his asthma had been in control, and recently we started having issues with asthma, flare-ups. And where, we keep the environment, try to keep it allergen free. He takes his control medications, but now that probably was the cause, the vaping. Um, I don't know. Lucy, you want to chime in, or are there any questions for me on that?
Hi, my name is Lucy Apsi Lopez, and I am a certified family peer support specialist for the Federation of Families for Children's Mental Health. I mostly work with immigrant families, although most of these families don't use tobacco. However, their children do. They either smoke or vape. I usually share with mothers, with families, the story about my father who used to smoke 2 packs of cigarettes per day. He started at a very early age. By the time when he was in his 40s, he had started to have health issues. By his 50s, his entire system was debilitated due to his tobacco consumption. He tried to quit several times, but nicotine was addictive and is addictive. He died at 56. I usually recommend families to talk to their children as soon as they know their children can understand. It's never too early to talk about the dangers of tobacco consumption. I ask families to tell their children to make their decisions now when they're little, so when the time comes and they are exposed to tobacco or other drugs, they will know what to choose. As Melody said, education and modeling are key factors in this process. Thank you.
So much.
Lucy, can you put your camera on?
Oh, I'm so sorry. I'm so
Thank
sorry.
you.
By mistake, I just, I'm so
No
sorry.
problem. I
Yes.
just wanted everyone to see what a wonderful, smart person you are.
Thank you.
And also, I wanted to add to what Lucy was saying. With the families that we work with, when it is very important to start talking about this as soon as they can understand. And it's important with the parents to, teach them modeling. If the kids see the parents smoke and all they're adults, and can make that decision, then they're more likely to smoke. But if it's not in the household and it's kind of discouraged, I think that's helpful. And also, if the parents are smoking, if the kids have started providing them with the resources, if they have a mental health provider, encouraging the parents to have them join in, on the discussion, because it does affect their mental health. And even at the school level, I contacted the school and they have been having that issue. But when I found out the kids there at the middle school are vaping in the bathroom and vaping outside, I discussed that. So now I think they're patrolling that area a little more.
And you guys, when you go into families' homes as family peer specialists, have you ever had to address families or felt the need to bring up a conversation around smoking with any families that you're working with or have worked with in the past?
I have had to, I had a family and mom's complaint was that she's missing a lot of time from work because her child is always sick. She didn't know what to do about that. The child's always, she was really frustrated because it was affecting her ability to take care of the household financially. So I softly, um, spoke to her about the fact that this child was always sick with bronchitis or asthma or allergies. The little child's eyes were swollen. Mom smoked in the house. She had made the connection that the smoking was probably why he was sick. So when I brought that up to her as gently as I could, um, she first seemed surprised. And then she said, well, that's the way I cope. I'm stressed out. That's the way I cope with, smoking calms me down. And I did not tell her that she needed to stop. I didn't admonish her, but I did suggest maybe you could, instead of smoking in the house, smoke outside. Even though the smoke follows you in, but maybe you could smoke outside. So she did, then she was concerned because now I guess I've told her she's affecting her child's health. But she did start smoking outside. And she did ask me about resources, and I had linked her to SAMHSA. Um, and she started attending um, a meeting. I don't know if it was like a NA meeting but she did start attending a meeting, and now she still smokes. And I no longer work with this family, but she did text me. This was a couple of years ago, and let me know that um, she only smokes occasionally, usually in a social setting, out and away from home. And her reduced smoking, not smoking in the home at all. And the child is doing well, hasn't been having all the flare-ups. Um, so that was one family, one example of a family I work with, that it was truly affecting the child. And it was affecting her health as well because she was having uh, chest pains and uh, trouble breathing herself. And once she made the connection and started getting help for herself, it improved in the whole household.
Sometimes families don't think that this is an issue that it will be placed on top of their problems or their issues. They feel that they have other issues to take care of, as depression or anxiety that their children, their youth are going through, that this is not something so severe. But you know as I said before, this is a topic that needs to be addressed when the kids are little, and when they can, as soon as they can understand the dangers of smoking tobacco. It is wonderful to talk about that, to communicate to the children, to educate them, so they will know what to do when they are older, or if they are already using tobacco, they will at least try to quit, or just try to do something else instead of um, consuming tobacco.
Okay. David, you want to turn back over to you?
Actually, I have a question that was just privately asked of me to ask both Lucy and Melody. Have you ever run into a family where the parents are smoking, and pretty much what you said, Melody, that the child has severe asthma, and child welfare had to come in and decide whether they should remove the child or not because the parents could not or weren't able to stop smoking? And if so, what did you do, or how would you handle that?
I have not experienced that, but I guess I would, if, for the parent who does not want to lose their child, have their child removed, I would look for resources to help them or introduce them to resources. To help them, because it's an addiction, to work on the addiction and work with child welfare. Have the parent work with the parent to work with child welfare, if they can show that they are making the steps necessary to make the changes, not smoking in the house, attending programs, making sure that the kids are kind of shielded from the smoking, because of course it's an addiction. You're not going to stop immediately. It's a process. That's I supporting them, not being judgmental, because that doesn't help. But it just encouraging them, if you want to keep your kids, and this is affecting your kids' life, this is their health. Next steps, we need to get help, and help them, support them during that process.
Thank you.
Yeah, and I was thinking too, the whole thing with smoking is, like we're saying, this an addiction is that it's no longer socially acceptable to be smoking in public. Like, people shun people who
Yeah.
smoke, right?
Mhm.
So it's like,
Correct.
it's like, oh, I smell cigarettes, or people have to go outside in the cold and smoke, and people like look down on them or whatever. And my son, he wants to, he does not want to keep smoking, but of course he's caught in that cycle. So I like the ideas of just introducing other alternatives or harm reduction, whatever it is. And I believe that they will talk more about that later in the webinar.
And I see our families all have a lot of questions, so I'm sure David will answer them before the end of today's session.
Absolutely. And I just wanted to give, I say, Lucy, I didn't know if you had anything else to add. I saw you come off mute and
Oh,
yeah.
yes. I had a family many years ago. The youth used to smoke at home. And then we talk about, that sometimes this kind of use of tobacco could escalate to other drugs. It did escalate to other drugs, and it did affected the youth and the family. And we talked, you know, extensively about, the dangers of starting with something like tobacco, that it has been, it's available to for purchase. Um, um, and how the negative effects can not only be or affect just the youth, but the entire family if this escalates. As I said before, I told the story about my father. This is something that it really, touched my life, touched my heart, and, affected my family. None of my siblings ended up smoking, not even myself, but, we saw that my father's life was cut short because of his consumption of tobacco for all these many years. That people might not think that nicotine or tobacco consumption is addictive, but it is. And it is, it is very difficult. Sometimes I see people that they can get rid of, they can, for instance, if they want to avoid drinking coffee, it's easier for them to stop drinking coffee than to quit smoking.
Absolutely. And thank you all for so much for sharing your stories today, your lived experience, what you all have dealt with. I really appreciate you all for having the courage and being willing to share that, as well as also how you're supporting families dealing with this, right? And I really love all the things I'm hearing about providing care, support, and resources. And we're going to be talking a little bit more about that throughout this webinar. I see, thank you, Gail, for just noting how many questions are coming in. I'm hoping as we go through today's webinar, that I'm going to be able to answer many of those questions. And of course, we have a Q&A portion today where we'll be able to take on many of the questions that you all have asked. So thank you so much, Melody, Lucy, and Michelle, for sharing and for providing that context and that information for us today. So we're going to proceed to the next section of today's webinar. And we're going to start out. And as we heard everyone's the stories that you all heard today of lived experience and how uh, tobacco use impacts the family, I want to give some more information, right, to educate folks a little bit about reimagining the way forward, or what do we need to know, right, as families and family peers supporting people on their tobacco quit journey. It was noted today how important it was for us to be able to provide resources. So there's some baseline information I'm able to share with you today. And to kick us off, we're going to go through a really nice little fun activity to help us. You've all probably done this before, myths versus facts, right? And so we're just going to use the poll function here within Zoom to talk about little myths versus facts, and we'll be able to provide some information throughout this process. So let's start us out first. So myths versus facts. People with behavioral health conditions are not interested in quitting smoking. So please select one. Is this a myth or is this a fact? All right. I see folks coming in, and I think it's safe to say we can end that one, right? I think the majority of folks are saying undeniably, right? And you all are correct that that is a myth, right? We can end that poll. Share, right? That is a myth, right? And we can share the results, Marissa, with folks so they could see. Everyone here has got that one correct, right? The majority of folks were noting this is a myth. The vast majority of people with behavioral conditions desire to quit smoking. All right. And we go to the next slide, please, Marissa. Right. I just want to know that people living with mental illness or substance use disorders want to quit and are better supporting their quit journey with access to treatment. Right? It is important to understand that smoking behavior and substance use disorder treatment, especially for patients receiving methadone maintenance and treatment for opioid use. Several studies show that over 90% of these patients smoke. Um, 70 to 80% express interest in quitting, and 65 to 75% have tried before. And a large majority, 75%, would join a cessation program, a tobacco use treatment program, if it was made available, right? So that just clearly shows, based on the research, right, that people dealing with mental health issues and substance use challenges want to quit. Now let's go on to the next myth versus fact, right? Smoking worsens symptoms of mental health conditions. Is this a myth or is that a fact? Smoking worsens symptoms of mental health conditions. Responses are coming in. Great. All right, Marissa, I think we can end and share this poll. And you all are doing such an amazing job. 87% of folks noted, right, that this is a fact. And if we could stop share, we can just pull that up on the screen, Marissa, because this is a fact. A common myth is that smoking alleviates mental health symptoms. And so that's really something that for us to really know. And if I go to the next slide, we can talk a little bit more about that. Right? So during the quick journey, it's important for us to understand that smoking does indeed make mental health symptoms worse. When someone stops smoking, they'll start to experience withdrawal symptoms from tobacco use, which really can mimic or intensify mental health symptoms. So this creates a vicious cycle where individuals believe that smoking is helping them to cope with any types of stress or anxiety or with their mental health issue, when in fact it's contributing significantly to their discomfort. Also, treating tobacco use is associated with improvements not only in one's mental health, but can reduce substance use disorder relapse as well. So the research is out there, and it really notes that, right? That really addressing smoking does support and help someone deal with their mental health issues and be successful in addressing the substance use disorders. Let's go to the next myth versus fact. All right, this one is people with behavioral health conditions can't quit smoking. Is that a myth or is that a voice? Folks are doing an amazing job. Marissa, we can stop and share the poll. And as you all can see, right, this is a myth, right? People with behavioral health conditions can quit with the right support treatment. Share a little bit more about that in the next slide, right? And so here are the facts, right? Bef- Tobacco use is an addiction, right? Most of our friends and family members with mental health conditions desire to quit or reduce smoking. It may take up to 30 or more quit attempts before achieving a successful quit attempt. So it's essential, really, that we normalize relapse as part of the quit journey. All right. And we all play a role in supporting our loved ones on their quit journey. And people with mental health conditions want to stop smoking and can quit smoking when provided with the right support and treatment. All right. So, all right, as we look ahead, to a new challenge emerging, especially for youth. And we heard about this during the discussion with Melody, Lucy, and Michelle. Vaping came up, right, as a big issue. E-cigarettes and vaping was really impacting the youth. And there are these newer products that are shaping new generations' relationship with nicotine. So we're going to talk a little bit more about that and provide some information, folks. All right. In the United States, young people use e-cigarettes or vapes more than any other tobacco product, right? Current 2024 numbers show that naturally 1.63 million students, or 5.9% of the student population here in the US, currently use e-cigarettes. And there's this growing narrative that downplays this behavior, saying at least it's not as bad as smoking, or at least it's not harder drugs. But this thinking is very dangerous. It shifts attention away from the real and lasting harms of nicotine addiction. And as you heard from our Michelle, Melody, and Lucy today, more about that, right? It really is an important issue that we need to address. And the truth is no tobacco products, including e-cigarettes, are safe, especially for children's, teens, and young adults. Most e-cigarettes contain nicotine, which is highly addictive and can quickly rewire a young brain. Nicotine exposure during adolescence can harm the parts of the adolescent's brain that control attention, learning, mood, and impulse control. All right. And most middle and youth and high school youth students who vape actually want to quit. This is an important reminder that many young people are not choosing to vape long term. They often feel stuck or pressured or misinformed. Protecting youth from vaping is a shared responsibility by both parents and caregivers, educators, school administrators, healthcare providers, family peer specialists, community partners. We all play a critical role in supporting young people. So why are so many youth vaping? It's the aggressive e-cigarette marketing, especially on social media, that targets youth with appealing messages and imagery. The availability of flavored products like mango, cotton candy, or mint makes vaping feel more fun and less harmful. There's peers. We heard about this from our discussion earlier. Peers and social influences. Seeing friends or classmates or influencers vape can create pressures to try or continue using these products. And finally, nicotine itself is a powerfully addictive substance. And once some people start, many quickly find it hard to stop. Right? So understanding why so many youth vaping is not only part of the equation. The next step is knowing how to support them in stopping. Whether you're a caregiver, a peer supporter, or a family advocate, there's evidence-based treatment options to help your loved ones begin and sustain their quit journey. So let's explore what those options look like. All right. So we have nicotine replacement therapy, also known as NRT, and it should be really considered an essential tool in supporting loved ones who are trying to quit tobacco. As a family peer specialist, you are not prescribing treatments, but you play a vital role in raising awareness and helping families feel more confident discussing and exploring options. NRT helps reduce nicotine craving without the harmful chemicals found in cigarettes. This can be especially helpful for individuals with mental health or substance use conditions where nicotine withdrawal worsens anxiety, mood swings, or focus. When someone tries to quit cold turkey, they often struggle with withdrawal symptoms. NRT offers a safe alternative, easing the transition and helping loved ones feel more in control of their quit journey. Here's the gold standard approach, right? Combining the NRT, like the patch, the gum, rod, the spray with smoking cessation counseling is the most effective strategy. As family peers, you can encourage open conversations about using these tools together and help families find the right supports to get started. The key message is that smoking is hard, but with the right tools, it's possible. You can be trusted voices that remind families there is help, there are options, and you are not alone on this journey. So let's talk a little bit more about the types of NRT that we just discussed, right? There are four NRT options currently available right now. We have the patch, the gum, the lozenge, and the spray, right? The nicotine gum provides quick release from cravings, right? You can chew it. The nicotine lozenge dissolves in your mouth and it helps manage sudden urges. Nicotine patch is something that you can put on your arm, and many of you are probably familiar with these commercials, right? You've always probably seen NRT before in the stores or probably in a commercial. And the nicotine patch delivers a steady dose of nicotine throughout the day. And the nicotine nasal spray is a fast acting spray that you can kind of squirt into your nose here and use for intensive cravings. So while NRT can be very helpful, it's important to remember it doesn't address every part of the quit journey, right? That's why we're noting combining NRT with other strategies like behavioral health counseling or getting someone connected to the quit line support is highly recommended for long-term successes for people dealing with behavioral health needs. So as a family peer specialist, you don't have to be a clinician to support this. You can just simply share this information, validating the struggle, and pointing families to resources that can make a real difference, right? And as we noted about the NRT, it's really important that we recommend and show families how to use it. One of the biggest things that we hear all the time is I use the gum, I use the lozenge, I use the patch, and it doesn't work. Well, really, there's some ways in which we can help to support folks. Many times it's because people aren't using the nicotine replacement therapy correctly. So here's some tips to help with families who are trying to learn how to use nicotine replacement therapy that you can provide them with, right? So we want people to use NRT consistently and as prescribed, right? It's crucial to use NRT consistently and exactly as prescribed to get that full benefit. Skipping doses or using NRT intermittently can reduce its effectiveness in managing those withdrawal symptoms and cravings, making it harder to quit smoking successfully. Use those recommended doses, right? Always use the recommended dose of NRT to ensure you're getting enough nicotine to curb cravings and prevent relapse. Using too little can leave you vulnerable to cravings, while using more than a recommended can lead to some unpleasant side effects. In terms of the patch, when you're applying the nicotine patch, make sure that people are placing it on a clean, dry, and hairless skin to ensure proper absorption of the nicotine. It is important to apply the patch to a different area of your body each day to avoid skin irritation. Don't wear the patch for longer than recommended and make sure to remove it before going to bed. Use nicotine gum and lozenges correctly. right? So with nicotine gum, you're going to be chewing the gum, right? You don't chew it like regular gum, right? It's not like Wrigley's. If anybody remembers Wrigley's, I don't think I've seen Wrigley's in quite some time. But if you nicotine gum, when you're chewing it, you just chew the nicotine gum and you park it, right? You chew and you park it here, right here between your cheeks, right? And that's really how you get the absorption of the nicotine. Same with the lozenges, right? You're going to be sucking in the lozenge and parking it here within the cheek so you get the absorption of the nicotine into the blood, to the bloodstream, right? And so in terms of nicotine gum, when you chew it slowly. As we said before, you park it between your cheek and your gum. And when you feel a tingling or sensation or taste, that's when you know it's working, right? That's when you know that nicotine is being absorbed gradually, right? Similarly with the nicotine lozenges, it need to be sucked slowly, not chewed, right? Let the lozenge dissolve completely in your mouth to ensure proper absorptions of nicotine and make sure that you're parking it between your cheek and your gum. Both methods are going to help you manage cravings effectively while preventing excess nicotine intake that can cause some side effects. Great. And we also have some ideas, right, for ritualistic behavior replacement. But we know sometimes it's just a ritualistic behavior. I wake up in the morning and first thing I might do is grab a cup of coffee and get a cigarette, right? So what are some tips that you can provide someone with how to just break that ritual of behavior of just smoking in terms of their daily activities, right? You can recommend that folks use a call a support person to get that support. Is there a friend, a family member that you can reach out to, that you can call when you're feeling like you're about to smoke a cigarette, right? You can chew gum, regular gum, right? Sometimes just having something in your mouth, this allows for you not to feel as if you need to pick up the cigarette. You could encourage people to do something healthy, like take walks, drink some water, right? Get into a group to really address these issues. So I start to exercise. I talk to them, ask them what might work for them. There are all these other great strategies to break ritualistic behavior. So you could also talk to them to figure out what are some other things you might be able to do to break that ritual. What are some ideas? You can work with them on figuring out those types of strategies. Right? Next. So we talked a little bit more about these treatment options just in general for people dealing with mental health and substance use conditions. Now let's talk about treatment considerations to support youth on their quit journey, right? And as a family peer specialist, you may support caregivers who are concerned, right? And we heard that throughout the presentation about a teen using tobacco or vaping products. So here are some key treatment considerations based on guidelines from the American Academy of Family Physicians and the American Academy of Pediatrics. First, you want to start with supportive, youth-centered counseling and encourage caregivers to approach the conversation with empathy and without judgment. The goal is to meet the young person where they are emotionally, socially, and behaviorally. Building trust takes time. This isn't about fixing the youth, it's about understanding and support. You want to use multiple ways to connect and let families know that counseling support can happen in different ways, in person, by phone, online, or even through printed resources. Helping youth access support in a way that feels comfortable for them can make a big difference in their ability to address their vaping, e-cigarette use. Harm reduction, right? It just really means helping, taking that framework, really means helping youth reduce tobacco or vaping use over time, especially if they're not ready to quit completely, right? And we've heard about it from everyone here that this is an addiction. We can't expect this a 360. It's a process, not a light switch. It's not an all or nothing progress. It's about progress itself. This approach helps reduce stigma and keeps the door open for continued conversations. And for teens with stronger dependence, meaning they're using it daily, they're going through withdrawal symptoms, or who want to quit but they're struggling, NRT may help. NRT, like we just talked about, like the patch, the gum, the lozenge, the spray, right? Now, just to know, NRT is not FDA approved for teens, but it can be used off label under medical supervision. So you would like to encourage families to talk to their doctor, say, hey, let me go to your pediatrician and ask them to say, hey, here's what my child is struggling with, right? Is there any way I heard about NRTs? That's something that might be helpful in helping them address their vaping or e-cigarette use. And they can help to support and guide that parent through the process, right? And also, we want to just note about some treatment supports for youth, right? We want to encourage parents and caregivers to be, once again, active, empathetic, and supportive, not enforcers. Peer mentors also can play a powerful role. Young people often listen more to their peers than adults. So if you have any peer mentors that can address this issue, it'd be great to connect them with the peer to have that conversation. Acknowledge and respect the team's autonomy and stage of readiness. And just know, let them know that we're here to support, not pressure. You want to use positive reinforcement, highlight strengths, celebrate small wins, and encourage progress over perfection, right? You also want to provide honest, age appropriate education, both in school and through community settings. As once again, we want to avoid those scary tactics, right? Focus on health and safety and informed decision making. You want to empower the youth with knowledge so they can make their own choices, grounded in respect and care, and equip families and peer supporters with tools to guide conversations. Control. And your role, really, as a family peer specialist, is to educate, empower, and help families understand that quitting is a process. Encourage them to keep that line of communication open with their teens. Let them know that compassion, consistency, and connection can go a long way supporting a young person. So, right. So let's take a look at some research for youth and their quit journey. All right. And so we have here first resources teensmokefree.gov. It's for National Cancer Institute, which is just a website that provides information, tips, tools, and live web-based support for teens who want to quit using tobacco products, including e-cigarettes. We also have Smoke Free Text for Teens, which is also from the National Cancer Institute, which is a text-based program to help young people quit tobacco use. 1-800 Now connects teens to their state quit line. Teens can get free and confidential support from a quit coach and get connected to additional resources. All right, and this is quitting program by the Truth Initiative, which is a mobile program designed to help young people quit e-cigarettes. And Not For Me, which comes from the American Lung Association, is a mobile-friendly quitting program designed to help youth aged 14 to 19 stop using e-cigarettes. All right. And also we have to find some resources for parents and caregivers supporting their child's tobacco quit journey. And so we like to recommend PAY, right? Parents Against Vaping and E-Cigarettes. This is a national advocacy and education organization founded by parents. PAY offers tools, webinars, and policy updates to help families take action against youth vaping. We have the HHS Hub for Parents, right, which provides for vaping prevention and quit resources. It's really an online hub from the U.S. Department of Health and Human Services that provides evidence-based tips, facts, and conversation starters to support parents and educators in preventing and addressing youth vaping. And also, we have the Truth Initiative, Vaping Prevention and Quit resources. And these are where they provide resources that offer practical advice and conversation guides and quit support tools to help parents and educators prevent and address youth vaping to support teens ready to quit. All right. So I'm going to open up the floor for some questions here and get myself a little bit ready here. We have a few questions that's already been asked. And so the first question here I see is, what do you guys offer for families who are deaf or hard of hearing? I'm trying to expand, and I would love for my company to notice that I am deaf family peer advocate to serve others' needs. Wow, that is a great question. I will have to go back and see what those resources are specifically for individuals who are dealing with auditory issues. I will make sure to put that on my to-do list. Nikki and myself here from CETFR will be looking resources up. Thank you so much for that great question. I'm so
And
sorry I don't have a
David-
response for you.
David, can I say something real quick?
Sure, sure, sure.
So even as far as looking to be a family peer support advocate, a lot of times we do provide technical assistance. And you could put in a TA request. A lot of times, I'm not sure if the person who asked the question has an interpreter, but a lot of times people who have hearing concerns do have interpreters that are available, or sometimes family peer support organizations can assist with that. So I will put the website link in the chat for TA requests.
Be great. Thank you so much. And we would be more than happy to see how we connect with that piece. And then if there anything specific for tobacco use treatment that we can link to as well. So Michelle, we'll be in touch well to support that TA request. Great. Next question I see here is I have a family whose mom shared e-cigarettes with her son who has a mental and emotional issues as well. I want to help them learn how to quit, but it's hard not to tell them what to do. But how can I offer the right way to approach? Because kids rely on mom, and moms has a hard time to say no to her son. That's such a great question. And the way that we really approaching this work is with love and grace. I think it begins first with education, right? Meeting people where they're at and really saying, provide them with education about what's the impact that this has, not only on their physical health, but on their mental. Approaching that conversation from that space of how can I help support you? I know that you all love each other and you want to see folks do well in their lives. And how can I support you on this? We know that there might be some level of resistance when it comes to change, but continuing to keep that conversation open dialogue in a loving and graceful way is the best way to approach that conversation. And really, as I think what noted, I think Melody shared earlier, I think sometimes knowing that a behavior, a parent might know more information about how it impacts their child might spur motivation to make a change, right? And this Melody's situation, she shared, the mother didn't quit altogether, but she did reduce her smoking and started smoking outside. She made necessary steps. So in my recommendation would be to start there. Of course, additionally, provide resources, right? There's great resources that we'll be able to share with folks after this webinar. We'll be able to share some resources that you can take with you and just have folks read it, right? If there's any handouts you can give them, say, take a look at this. Let's read through that. Let me know if you have any questions. I'm here to support you. I can connect you with any resources would be the best way to go. Right. So much for that question. The next question that came through is how do you respond when my mentally ill daughter says it's not that bad, that they're vaping and smoking marijuana? It's a great question, right? It's always really tough to, and I also open up the floor to Lucy, Lachelle, Melody. If you have any thoughts to share, as family peer specialist, how you would want to approach supporting someone on this. If anyone has any thoughts on how you would respond.
Well, really with my son, I can't really prohibit him. He does not live in my home, so he knows he cannot smoke in my home. If he's in my car, he cannot smoke in my car. So I set those parameters around him. And I just try to have conversations with him around, how do you feel about it? I think that definitely with the marijuana, that episode he had, it scared him enough to steer clear of it. But with the smoking, I just see his struggle constantly, but he continues to, sometimes one thing that I've noticed that he'll try to just buy a limited amount, but he's walking to the store, So I think you just have to give them space and provide them with information. And it can be frustrating as a parent knowing the effects of what they're doing is going to in a long time hurt them, but gotta just stick with them.
so much for sharing that, Michelle. I don't know if Lucy or any Melody have any thoughts there.
I agree pretty much with what Michelle said. I don't have any extra to.
Thank you so much. Yeah, wonderful, wonderful. Meeting people where they're at, right? It was, all begins with that conversation and education and going through that process and that journey. Great. Wonderful. I see here a next question here. Our 20-year-old daughter has turned to cigarettes to try to reduce herself vaping. Can you give suggestions for successful nicotine addiction recovery steps programs? Right. So, of course, we have the Quit line is always a good resource, right? That's readily available to folks. But I also encourage everyone to really reach out to their behavioral health provider who has all the necessary tools to provide support for treatment for any type of addiction, including e-cigarettes and, of course, for vaping, e-cigs, and combustible tobacco products. They can be able to provide that level of support. I'll encourage folks to have conversations. If you're part of case conferences and you're working with families or you're working with your daughter's behavioral health provider, that maybe this might be part of just something that you might know as something that they might want to bring up and address while they're providing those behavioral health services. And then also additionally, like I said, your quit line was great. They There's another program called Nicotine Anonymous, which is not much well kind of attended as much, not as popular as AA and NA, but they're also that problem. They're NAA, which is interesting. But definitely there are those types of resources that you can connect your daughter to, recommend. Those are some of the steps that I would take. Right. All right. And I see here another question that's coming across. My son 17 will be coming back home soon and stating that everyone in rehab vapes and that he simply can't be successful in treatment without it. Wondering if and when I should set a limit. Hmm, it's a great question. And I don't want to take up all the airspace here. I don't know if any thoughts. I think from the rest of the folks here on our panel.
Yeah, I would just say the same thing around guidelines in terms of your expectations in the home. Because really that's literally all you can do. That's my thought. Lucy or Melody, what do you think?
Yes, communication, education, I think that they are extremely important to communicate with the youth and just try to make the youth think, about the things they are doing and the the effects, long-term effects or mid-term effects in their lives. It is also important to talk about change, as we have mentioned this before. It is important to mention. I remember a friend, they used to smoke not only cigarettes but also cannabis. She said that she stopped, she quit smoking because she thought that she needed to not only to change her life, but to make a sacrifice so that will mean something to to her in her life, in her beliefs, in her faith. If she will make that change and that sacrifice, will um will improve her life. So just talk to your children, those ones that are using tobacco at this time or using other substances. Talk about changes in their lives and how those changes can improve the outcome of things that they are doing now.
I think it's important that parents do establish boundaries or, limits. I understand that he's saying that everybody there vapes, but if you don't allow it in your house, you don't allow it, not make an exception for it. And that comes with, like Lucy said, education, modeling. And then I guess when he gets home, make sure that he has other resources, including, I'm big on therapy. I think therapy is a helpful tool. So maybe if he comes home to therapy in place, and additional resources, you could change his desire to, or his thought pattern that everybody in rehab vapes. With education.
And Melody, I love what you're saying in terms of therapy, because yeah, therapy definitely is going to help. And if your 17-year-old or whatever age your child is coming home, having some of those, what David discussed, nicotine replacement therapies in the home, maybe have patches or maybe have, gum, or something like that as an alternative, just for him to say, look, I'm not saying you absolutely have to quit today. I know that you started doing this while you were there or whenever you started. Let's just see how it works for today or for a couple hours. You know what I mean? So it's not that it's just, you guys are both kind of learning together.
Yeah, that's good. Yeah, that's good. Because if you take a hard stance on it, then they could rebel in a different, a more serious way. So, and I know that we talked a lot about, and I don't want to get off the subject too much, but I know we talked a lot about cigarette smoking and vaping. But another thing too that young people are doing is that hookah. Which is, when I researched it, 45 minutes of doing hookah is like smoking 15 cigarettes.
Wow.
So that's dangerous. That's unhealthy. And just something I just wanted to mention, because they are doing the hookah too.
Yes, they are, Melody. Thank you
Yeah.
so much for noting that. Yeah, hookah is definitely something that we don't oftentimes talk about. But definitely
Right.
when people go out, it's the new thing to do. You go out to the
Mhm.
club and you take pictures and you sing, you dance, you got your hookah. But a lot of times people don't realize how much you're taking in. As you said, 45 minutes. 'Cause sometimes some research says up to 30
Yeah.
cigarettes in one sitting, 45 minutes of just hookah smoking. So it's something to really know. Um, Great. So I want to make sure I think I have time for one or two more questions, right? Are the resources for adults that are former substance users that have been smoking tobacco for years, like a support group or programs? Yes, they are resources for that. And they have either tobacco use treatment, cessation programs, or as I said before, there's a little known program, and I know that I can give more information about the nicotine anonymous folks. But I do know there's a group of folks who really come together and similar to AA and NA, they address tobacco use and approach it in a similar way. But that's, it's a support group that really does that and provides that kind of support long term. And it's an interesting question that's noted here. Does anyone have any info on non-nicotine vapes, the tool for quitting, and if they're safe? Um, they are not FDA approved medications. There are only 7 FDA approved medications for treating tobacco use. Those are the nicotine NRT replacement therapies that I noted here today, the nicotine gum, the patch, the lozenge, the spray, and then we have varenicline, bupropion, non-nicotine, non-NRTs, right? And so those are the only 7 FDA-approved medications that have been known to be safe to treat tobacco use, including e-cigarettes and vaping. Now, they are non-nicotine vapes that are out there in the market, but to say that they're safe, no one knows. The FDA doesn't properly regulate e-cigarette products, so half the time we don't know what's in these products. And so we don't, during COVID, I don't know if folks remember, there was Ski Valley where tragically some of our youth ended up passing away, and it was because of the products that were in the vapes, right? And so we just have to be very careful taking on or using vaping because they're not totally safe. We actually don't know really what's in them. So just giving that note, that is my would my strict recommendation would be to use some FDA-approved medications. Yeah. But as we say, speak with your provider, talk with your medical provider, talk with your behavioral provider, and let's see how you have that conversation and see what might be able to work for you. All right. I think the last question I'm going to give it to here is teens are hard. Are there any trainings in schools or specific programs to reach out to? Yes, and I think we just noted a few of them here. We have PAVE, we have Truth Initiative, HHS has some great resources. So you can definitely reach out to those, take a look at those resources. They'll be able to provide you some great information. And just a note for everyone, once we share out the recording of this webinar, will also have some resources for you to be able to get to access these things. And we will share the slides as well. So you'll have all this information, the recording, the slides, and a portfolio of resources for you to be able to utilize in your work or for your families. Great. All right. Well, we know that we have some questions that we did not get to. Not to worry, we are taking all those questions down. We're going to try to respond to them as part of the resource. We'll try to get to them and respond to them. So you might be able to get the answers now, but we'll definitely try to get you an answer when we send that through. Great. All right, so let's wrap up here. All right, so what are some key takeaways? Get myself back here. All right, first, people in recovery want to quit, right? If people are dealing with mental health or substance use challenges, they want to quit and they need the right type of help and support to do that. Next, it may take multiple quit attempts to achieve a successful quit, right? And so just want to let people know we need to normalize relapse as part of this. It may take up to 30 times for somebody to treat. It is highly addictive. And so I think we sometimes think of tobacco as it's a bad habit. It's an addiction and it's a serious one. So we have to approach it with love and grace. As to those folks, if they fall, we let them know that's okay. That is part of the process. We got to get back up. I'm here to support you along the way. All right. And then you need use combination NRT, right? We talked about these are over-the-counter medications. In some states, you can get them free depending on your health insurance coverage, right? But you can get access to combination NRT patch or the gum, the patch, or the lozenge, the patch, or the spray, right? Those are things that you can use to help you address tobacco use. Those really highly effective in helping to address those withdrawal symptoms and those cravings that people may experience when they're dealing with trying to make a quit attempt. And finally, there are treatment options and resources to support youth and families in the quit journey for both smoking and vaping. And of course, right, we'll share some of those resources with you post-webinar. Right? So we're going to dive into how the COETFR and NFSTAC can support you and just do some closing. Right? So as a COETFR, we provide you with webinars, training, and evidence-based practices and interventions, innovations, and other relevant topics with a focus on reducing commercial tobacco use among people with behavioral conditions, provide tailored, customized technical assistance to states, behavioral health organizations, families, peers, and other partners regarding efforts to reduce tobacco use among individuals with mental and or substance use disorders, and other relevant information to realize goals. We develop and design and convene leadership academies and to engage state teams comprised of behavioral health and tobacco control leadership to develop and implement state action plans to reduce the rates of commercial tobacco use for people with behavioral conditions, and through strategic communication dissemination activities anchored by a project website. We ensure target audience members have the information about current research, evidence-based practices, policies, resources, and training opportunities. And I'll turn the floor over to Lachelle.
And here at NASDAQ, we do monthly presentations. We have a Family Connections, which is the first Thursday of every month. As you can see, if you have your phones, you can scan the QR code and get information to our events. And really quick, I will put our link to the events in the chat. But feel free to reach out to us, whether it's for technical assistance or to join us on one of our webinars, our family connections, or our office hours. So we'd be happy to hear from you.
Thank you so much, Shelly. Appreciate it. Next slide, please. All right, so we thank you so much for joining us for today's webinar. Just to note, your feedback is extremely important to us. We're gonna, please complete the anonymous webinar evaluation. We're gonna drop that quickly in the chat. Just click it open, right? Just make sure it's open on your screen before you leave today so you can go back and get to it when you can. It will only take just a few minutes. And also, just remember, we're gonna be emailing you with some information related to the webinar. That includes the slides, resources, questions that we didn't get to. We'll provide that, and also a recording for the webinar. So please be on the lookout for that. All right, and thank you so much for participating in today's webinar. I wanted to also give a big shout out to our partners here. Lachelle, thank you so much for the National Federation of Families for all the work that you do and for your center. Lucy and Melody, thank you so much for sharing your stories today with us and just the work that you do. We really appreciate it. Have a great day, everybody. Talk to you all soon. Bye-bye.
Bye, guys.